Thank you, colleagues. Commissioner, President, a report by the United Nations outlined that Russian forces have committed an array of war crimes, including torture, rape and other acts of sexual violence against Ukrainian civilians. And in the face of this extremism, this barbarism, millions of Ukrainian women and girls are forced to face the aftermath of this violence and make impossible decisions. For refugees who have experienced this violence, a lack of healthcare, a removal of inclusive reproductive care forces them to return to Ukraine and return to their war-torn country to access essential reproductive health care, including maternal health and abortion care. All of this because they cannot get access legally in all European countries. These women, who are victims and survivors of violence, dealing with compounding trauma, health scares and concerns, mental health damages and supports, the slew of endless mental and physical health conditions, all without the basic services and support they deserve from us in the EU. The provision of sexual reproductive health care saves women's and girls' lives, and we cannot leave anyone behind. Thank you.
Colleague Walsh, would you accept a blue card from Karen Melchior? Yeah.
And thank you very much, Ms. Walsh. You were explaining the horrific consequences that the lack of access to healthcare for Ukrainian women fleeing from war could have. For most of us, fortunately, this is an abstract idea. For many millions of women in Ireland, it was their daily risk, their daily lives. Could you perhaps elaborate a little bit more on the experience in Ireland of not having sufficient access to healthcare? Thank you.
Thank you very much, colleague, and thank you for giving me an opportunity to highlight, even within the EU, our EU citizens, again, disproportionately affecting women in my country of Ireland, have been underserved at a national, local and an EU level in terms of access to sexual reproductive healthcare. Many still fleeing to the United Kingdom or further afield, many not seeking and getting the support they need in their local GP or hospital. And unfortunately, we have a very darkened history of such. When you look at the clerical abuses and the institution abuses of the Magdalene laundries, of the mother and baby homes, of other institutions where we've swept the support around sexual abuse, sexual violence, the requirement for abortions, and the decision by women to have a choice over their bodies further afield. So we know too well what many of these women are going through. Thank you very much for your question.